So today, being a man crush Monday, we are still working on men. Ladies pass. Going to start about BPH. You have always heard people say, I have enlarged the prostate. So the condition is called BPH, which is benign prostatic hyperplasia. So as we move on to know, one thing we should know is that this thing is non-cancerous, and it is the enlargement of the prostate. However, this BPH disorder and the prostate cancer have overlapping symptoms. They always look the same, but they are different issues. So what is this BPH? BPH is a non-cancerous enlargement of the prostate gland in males. Of course, anatomically, you know that if this is the bladder of a man, this is the ureter. The prostate surrounds the ureter, which collects urine from the bladder outside. Now, the unfortunate thing is that this enlargement of this prostate squeezes this ureter. The ureter, which was having flow of urine, gets a problem. Now, the cause of this BPH, studies show that it is not clear, but however, it has been attached to a number of things. Old age, men who have 40, 45 years and above are prone to having this. Number two, hormonal changes. Then a number of hormones in males. For example, we have testosterone, hormone change. We have straining to urinate. You have had people who even gas when they want to urinate because of straining the muscles and what. We have urine hesitancy. We have weak urinary stream. A person urinating a stream of urine that is very weak. So the question is, now what should we do about this? One, make sure you go to a health facility for diagnosis. There are a number of things which are done to prove and confirm BPH. Then after that, you should know that if unattended to or not treated, it has a number of complications. And these include things like acute urinary retention, failing to urinate. We have recurrent UTIs. Because urine is not getting out of the bladder easily, it is easy to keep on getting UTIs. We have bladder damage. We have kidney damage. So, after you have got treatment and you avoid such, for example, you can make sure that you limit caffeine intake. Those who like taking coffee, you find that you urinate a lot, especially at night. Limit alcohol intake. You can reduce on fluids, especially before bedtime. You can also avoid delaying to urinate. If you feel the urge, you go and urinate. We can also have regular exercises, because we saw that lack of physical activity is a risk factor. So in the future, we shall tell you natural supplements and herbal products that are good at countering such conditions. But for now, first have this information.